Hello, everyone. Good afternoon. My name is Dr. Gauri Kulkarni, and I head the medical operations at MediBuddy. Today, we're going to talk about something very important with the pandemic situation. I think a lot of us have been feeling stressed, and the last 1.5 years has definitely taken a toll on our mental health. As a doctor myself, I have felt it at an individual level, and I see it all around me, be it people I know or my patients. And hence the reason that we are talking about mental health and its relevance in this pandemic phase. Right. So please bring out your questions if you have anything specific that you would want to ask. But I would want to talk today about what we can do in the current situation, and what we can do at an individual capacity and as a community to help each other in mental health well-being. All right. So, last 1.5 years we've seen the COVID wave 1, then the wave 2. There are already there are speculations about when will the third wave come in, and it has definitely left us feeling unnerved, anxious, worried about our future, right? It's becoming so difficult for a lot of us. And I have seen that affecting, at an individual level on their physical health. It is affecting, within the family unit health. People are getting affected at their work. So a lot of things are getting affected because of these strain and worries that people are going through, isn't it? So let's go first by, initially first understanding, what are these mental health issues that have come up now, right? Like, what is it that we are seeing more as a doctor? What is it that I am seeing more in people who come up and ask about mental health issues, right? So we see a large number of people who are undergoing a lot of stress. There is anxiety, there is worry, there's a lot of uncertainty about the future. A lot of people are also exhibiting different kind of emotions, right? Excessive anger, right, towards maybe it's a public behavior, or people becoming very angry or violent at times. There is also this sense of loneliness, and in many people, because they are staying away from families, a sense of boredom, and that is also leading to a drained out feeling, a feeling of a low or a sad feeling, or feeling depressed at times. Fear and worry about what if the disease comes to me and then my family, or the guilt that people may go through about the possibility that, what if I am the source of infection to the rest of the people around me and my loved ones, right? So there's these so many things that we are seeing, that people are exhibiting when it comes to mental health, right? When we say mental health issues, it doesn't mean that it needs to amount to a disorder, right? But a lot of us go through emotional upheavals, emotional up and down, and that can really affect us in the way we exhibit. So a lot of how would we know that we are having a poor emotional health, right? How do we understand that something like this is happening, either to ourselves, in our own self-awareness, or to people around us, right? So few things that can be is the change in our emotional state, right? Either am I feeling anxious or worried, or feeling low or sad, or there could be confusion. I'm feeling confused with my thoughts, and I'm unable to say concentrate, or there's too much of procrastination at work. That could be also something that comes under, say, poor emotional well-being, right? Other things that can be is a sense of being withdrawn, that I don't feel like being with others around, right? That could be something. Or excessive fears and worries, or even extreme mood changes, like people who might suddenly have crying spells, that could be there. A lot of manifestation and behavior can also be seen, right? Like a change in eating habits, right? Maybe too much of eating or too less eating, or change in sleep patterns, excessive sleep or very poor sleep, or it could be patterns in our volition, right? Doing too much or too little, right? That could be also a pattern of behavior changes that we see when there is poor emotional health, right? Other things that one can observe in self or others is change in habits in terms of use of, say, recreational substances, such as, say, use of smoke or alcohol or tobacco or any other recreational drug. There's increased use, or there's a tendency to rely on them to feel relaxed, right? That is also something that is seen as a symptom of poor emotional health, right? Sometimes uh, sudden, what we call a psychosomatic aches and pains, that is sometimes symptoms of mental health can present as a physical problem, like severe aches and pains, stomach pain, back pain, neck pain, aches and pains which are unexplained otherwise, right? So I think the way mental health issues can manifest can be varied, and a lot of times it is important for all of us to open up ourselves to the fact that maybe this is happening to us, or maybe that it is something that is happening to a loved one around us, and being more aware about it, because I think awareness is the first step to even trying to do something or trying to bring in certain changes, right? So I think that's extremely important for us to work with ourselves when it comes to mental health, well-being. Okay, why is it that we're talking so much about mental health these days? Is because of the fact that it is when we talk of holistic health, right? When we talk of every, it's not just that we focus only on physical health, right? There's so much importance that needs to be given on our mental health, our social health, our spiritual health, even our financial health, right? So I think there's a lot of things that have to be focused on, primarily because health has always been, in most people, the thought has always been around physical health, and hence there is a lack of awareness about how we can take care of ourselves when it comes to our mental health well-being, right? A few things, I mean, of course there are a lot of things that we can talk about mental health itself, but I think that it's important for us to understand that there are a few things that we can do. There's a few things that we can do when it comes to mental health well-being, right? On a daily basis, right? I think it's important that we focus on a few things. Number one, our sleep pattern. Okay, I think it's a lot of us during this pandemic phase have, and because of our emotional ill health, we have seen that our sleep is not very good. Okay, it can be that the duration of sleep is reduced, or our initiation of sleep is the problem, or the maintenance of sleep is a problem, right? In either of these cases, I think it's important that we look at sleep as a powerful technique to keep ourselves mentally much better and taken care of. What can we do to ensure that we have a good night's sleep, right? If I had to go into the science of it, I think it's important for us to know that our body works in a rhythm, right? There's a circadian rhythm, which means that our brain knows that the light is reducing, which means it is the day is ending, and hence it is time that our body starts resting, right? So there is a hormone which is released in our brain. It's called melatonin, and the release of melatonin is triggered when the ambient light reduces. Okay, so once that happens, your body function slowly goes down, and then you are supposed to sleep. But what happens, because of our continuous feeds through our, say, digital, be it our laptops or our phones or any digital aid that we use, we are not able to kind of put ourselves to sleep or rest, right? And that can lead to a poor mental health. So the first thing that we need to do is look out for what we can do, what we can do to help, reduce the the sleep issues that we might be having, right? So I think that's very, very important. Now, the other thing that I believe we need to focus on, apart from our sleep, is on the fact that what we are doing for your physical health, because a lot of things that happen for our physical health will also affect our mental health. So am I ensuring that I eat right? Am I ensuring that I have, I'm taking enough amount of balanced meals, small frequent meals through the day? Am I seeing that there are enough vitamins and minerals in my diet? Am I ensuring that I'm drinking enough water? I think these things really help in the long run for our mental health functioning. The other thing that is very important and has come in the forefront is definitely sunlight exposure. It has been proven that if there is vitamin D deficiency, it does lead to low moods and emotional upheavals, right? So it's important that you get enough sunlight, because I think that helps in the long run for you to feel energized and for your mental health to be well. The other thing that is extremely important is that we put in at least some amount of time in doing some physical activity. Now, we always correlate physical activity with physical health, right? But we don't correlate with the fact that physical activity actually helps in our mental health, right? So when we are physically active, it helps us over a long period of time to increase the blood circulation in the body, increase the blood circulation in the brain. It helps in release of a lot of good hormones in our brain. These are, if I had to say it in layman terms, these are called feel-good hormones that give us energy, that helps us to kind of get a kick for all of us to be able to get along through the day, right? So it is very important that you put in some time in doing some physical activity. Now, physical activity could mean different things for different people, right? Now, for example, some people may like to say do yoga. Some people like to do Pilates. Some people would like to do Zumba, and some people might want to hit the gym, right? Whatever that works for you. Of course, keeping in mind safety because of the COVID situation, but whatever it is that makes that you are more comfortable with and something that you can be more consistent with, I think that works the best. But putting in some time for this really helps in the long run for you to help with your mental health well-being as well, right? So I'm of course I'll continue talking, but because I have a couple of questions, I would want to take the questions first before we can go ahead. All right. So let me go ahead and ask, right? How to motivate under this condition of pandemic, how to motivate employees? I think such a beautiful question that you've asked. I know that many people here who might be listening also have a lot of people that work with them, right? Or they report to them, or they are their colleagues, right? And it is important for us to do, maybe I'll say two things, right? One, I can motivate somebody if I am also showing them the way that I do this and this seems to be working for me. I think that works one. The other thing is definitely to help them by listening to them. I think the one thing that I keep telling people about what we can do, to say what is healthy in this. How do I go ahead and be supportive of people, right? I think one and I think the only thing that is most important is listening. If I can give a listening ear to the people who matter to me. Now, this could be my family, this could be my loved ones, this could be people who I work with, people who are subordinates, or people who are with me, my colleagues, whatever, whoever they are. But if I can give them a honest listening ear, and when I say listening ear, that includes showing genuine concern for the issues that they may have, I think half our battle is won. So that, I think, is the first and most important thing, is to be able to offer them a listening ear and being available for them and helping in that communication, opening up those gates of communication, I think would help in the long run for us to be able to motivate people, because then they know that they are not alone, right? Most of the time people feel that I'm alone in this situation, right? A lot of people feel that I'm the only one going through this. But if they understand that, well, there are other people also, and then other people are able to battle it in a certain way, maybe those will help you to, over a period of time, motivate people around you. Okay. And of course, I think it's important for us to extend helping hand, right, whenever it is required, because well, this is a situation where we need to go overboard and ensure that people are helped in whichever way possible, right? So which daily routine to be followed for healthy mind condition? Beautiful question again. I think as I was just going through a few of the things, I think healthy living is so important. You know, good night's sleep starts with that first, right? A daily routine where, and I know that a lot of people say, oh, I have late night calls, so I'm not able to get up early. Whatever that takes, right? Everybody has their own rhythm, right? Ensure that you are getting at least 6 to 8 hours of sleep, okay? And to ensure that you get that sleep, you know, have a detox period without your screens for at least about 3 odd hours before you go to bed, right? So that you know that you're not stimulating your eyes and reducing the release of melatonin. So do that, right? Ensure that you are going to bed, you know, with a wind down activity, be it just like reading or listening to some soothing music, or just having a you know, simple conversation with the loved ones around you, or just taking a warm bath, maybe a glass of milk if that helps, or a small snack just before going to bed. For some people that works, but get into a sleep routine and try to do that more or less at the same time, because that helps in the long run for you to establish a routine, right? That helps. And that also helps you to get up more or less at the same time. It's important for you to understand that with daily routines, and I keep saying this also, that you know, now that a lot of people are doing work from home, I see a lot of people telling me that, well, their bed is their office, right? Because people just get up, you know, open their laptops on their bed and start working. um, it may work for a few people. Most of the time that it leads to not being able to compartmentalize workspace from a home space, right, or personal space, right? So it's important that when you are in a work from home scenario, you have a workspace for yourself, right? Now, of course, not everybody is privileged to have a desk and a chair and everything, right? But that doesn't stop you from having a corner in your house which you call as a workstation or a workplace, where you can sit there at one place and call it your office, right? And as you would always do, as you would, you know, before the pandemic hit, you would get ready, go to office. What is stopping you from doing the same routine even when at home, right? I think you should build that routine, because when you were working in the office, you would shut down your computer at some point in time and go back home. But what is stopping you from doing the same thing even now, right? It's all about telling yourself and being committed to yourself about doing that, right? So I think ensuring that on a daily routine, you have your time for your breakfast, lunch, dinner, maybe two or three small snacks in between, which is healthy, of course, you know, picking up healthy choices when it comes to eating on time, ensuring that you are having water. The simple thing that I do is, you know, set a reminder on your phone, or on your laptop, which pings up. You know, there are so many reminder systems now available where it can tell you that it's time to drink water, right? So that you do not forget things which are important for your own health. Ensuring that you have those things. I think one of the things that helps me in having a daily great routine is that I more or less prepare that routine the night before, right? I usually have a checklist which is ready, which tells me what am I most probably going to do tomorrow, right? Plus minus, of course, things, there are always emergencies or contingencies, or things like that can happen, but more or less, if we are prepared on what's going to happen tomorrow, it makes our tomorrow much easier, instead of getting up in the morning and then wanting to decide, oh, okay, let me see what is on my list, right? Some people like to do it early in the morning when they get up, and that's also fair. But having that lets you then, you know, feel accomplished at the end of the day, because then you know that I had set out to do 10 things, I've at least been able to finish 7 or 8 of them, which is great, job well done. And it gives you a sense of accomplishment through the day, right? ensuring that you find time for doing some physical activity, I think, is extremely important. Now, you could find like an hour to do your exercises, and a lot of people keep telling me that, oh, I can't find that much time. Well, then I tell them the simplest thing, at least after your three major meals, take out 10 to 15 minutes time to just pace around in the house. That's the bare minimum that you could do, which already gives you like 30 to 40 minutes of some amount of walking time, or being on the feet time, and that helps in the long run for you to have some physical activity. um, I think 15 minutes is less, but I ask people to bring out at least 15 minutes, 15 to 20 minutes of time each day, and this is compulsory for them to do something that they truly love, right? This is a pleasurable activity, and I think this is the core. If we are able to do that and give that to ourselves. Now, this pleasurable activity doesn't mean sitting in front of the TV and binge watching something. No, this is something that is more of a creative pursuit, right? If you're staying alone, then maybe learning something new. If you have a family, maybe doing something with your child, or doing something with your spouse. I think it takes you a long way, because then it's not just about finding something which is more meaningful. It can also turn out to be something which is productive. Like, for example, dancing around with your child, it will be a physical activity as well as a fun time spent with your child, right? Something like that. So ensure that you have that in your daily routine. As I said, if you have set out with your things to do a night before or early same morning, it gives you a lot more pleasure at the end of the day, because you would have a sense of accomplishment of what you did. And if you can just follow these basic things, most probably you will have a much more routine day, which itself is great for your mental health, right? Hope that helps you, isn't it? So there's a question about what healthy foods require to take after COVID-19 recovery. Good question. I think a balanced approach is most important. Okay, a lot of people, ask, what kind of fruits and vegetables. I think you can have all kinds of fruits and vegetables. All of them have their nutrient properties, which are great. Ensure you have enough, great, about say 3 to 4 portions of fruits and 3 to 4 portions of vegetables every day. When I say portions, about 100 ml to a 150 ml bowl. And ensure that you have protein in every meal. I think that's very important. Have a moderate fat and moderate carb in your diet. Ensure a few of the things that you can have is have a few nuts every day. If you eat egg, I think boiled egg a day is great if that works for you and it suits you. Other things is ensuring that you have enough water intake. About say 2.5 to 3 liters every day. Ensure that you remind yourself to drink water every day, right? And also ensure that you have spaced meals, right? Ensure that you have meals on time, right? That itself gives you a lot more, your system is better, kind of gets regulated on how it would work, right? So ensure that you have that. But the essence is to have enough proteins in every meal, ensuring having enough fruits and vegetables, and a balanced meal at that. You could talk to a dietitian who can help you further to have more breakdown of what exactly, according to preferences and choices, because everybody would have different preferences and choices. But ensure that these basic tenets are used. I usually tell people to have food which is low on spice and oil, and low, mildly salted, rather not too salted, and also low on sugar, right? There's nothing that we need to not take unless you have a problem. Like if you are a sugar patient or diabetic, then of course you would have to avoid certain things. Or if you are a patient with high blood pressure or hypertension, then you would have to, or a heart disease or something like that, you may have to avoid a few things. But in general, the principles are that you have a balanced approach to your meals and have equally spaced meals on regular timing, and they do help you in the long run to recover well. Ensure that you are getting into some physical activity in the post-COVID recovery phase. Not that you have to start exercising immediately and for long term, but in say 2 to 4 weeks time from your recovery, start doing at least some amount of basic exercises, just stretching your body. Because a lot of time muscle soreness is there. You're still having a mild cough. So, doing breathing exercises, doing chest rehabilitation helps you in the long run to able to, so that you can recover faster and better. All right. So that's some of the few things that you can do with your food intake. How to manage stress as there is a lot of uncertainty around. A beautiful question, isn't it? Yes, and a lot of our emotions are coming up because of the uncertainty around, isn't it? We do not know what's going to happen. Is the COVID going to hit? There is going to be a third wave? What is going to happen to me? What is going to happen to my family? Or what's going to happen to people I know or work with, or what's happening? So there's a lot of uncertainty around us, and that has led to feeling more stressed, anxious, worried, a lot of fear, right? So a lot of those things are there, and I think it's important. The one thing that I'll tell you, the fact remains that we live with this uncertainty forever, right? Because we don't know what's going to happen tomorrow. The fact remains, even if there was no COVID, right? So the fact is that we are not sure about what is tomorrow. So we have to live with that uncertainty. And what happens with that uncertainty is that there's a sense of lack of control, that I don't know, because I don't know what I have to do, right? So that sense of lack of control, and we are usually individuals who would want to have control, right? That's typically how our nature is. And because of that uncertainty and that lack of control, we tend to have all these emotional upheavals. Now, one of the things that I tell people is that is to get into a phase called as preparedness, right? So when I say preparedness, what do I mean, right? I think preparedness means that, well, I do not know what's going to happen tomorrow, but I have a probable understanding of what may happen. And typically when I say what may happen, typically we have a tendency to think of what's the worst, right? So I think preparedness takes us a long way, right? When I say preparedness, it is a different. When I talk from a COVID-19 perspective, right? Preparedness could be things like, do I have a thermometer and a pulse oximeter with me at home, right? Do I have a contingency plan as to if I do get affected with COVID-19, do I have a place where I can isolate myself, right? Do I know where do I reach out to for a doctor, right? Do I know where do I get medicines from? Do I know how do I do this discussion with family members? If I have a family and I stay with, say, maybe a spouse and a child, maybe there are elderly parents, how do I have that communication with everyone, right? What is the contingency plan if say both the husband wife have COVID and the child has to be taken care of? What do we do then? So I think, thinking about this, and I know it can be sometimes scary and we don't want to think of these things, right? And we want to run away from thinking of such things. But the fact remains that when we are prepared with this list and we have answers to these questions, it just makes our life a little more easier, because we know that if it had to happen, I have made all my corners ready, right? And then I can take action if it had to. So it's like insurance, right? We buy insurance, we never want to use it, right? Nobody wants to use contingency plans, but it's always nice to have that preparedness and have a contingency plan. And so you need to have it based on, who you are, what kind of surroundings you have, who do you live with, what is your workplace like? So those kind of preparedness definitely takes a long way in being able to work with this uncertain situation that we are in, right? It also brings in some kind of peace, okay? Now, when we think of, say, lack of control, right? I feel, I don't know what's going to happen tomorrow. And then we say, oh, I feel a sense of loss of control. One needs to step back and then see what is in my control, right? Definitely, I am in my control, which means my body is in my control, right? Which means my health is in my control. I cannot control, say, somebody else is going to wear a mask or not, but I can control what I can do, right? Which means I can take care of my physical health. I can ensure that I'm taking, if I have any chronic diseases, I'm under regular medication and I'm getting it monitored with a doctor. I can take care of my physical health in terms of, say, diet and exercise, good sleep, sunlight exposure, de-stressing myself, drinking lots of water. Those are the things that I can do because that's in my control, right? What I can do in my control is to follow all preventive measures when it comes to COVID-19. Those are the things I can do when I those are the things under my control. So when I do things which are under my control, at least I have that sense that I have prepared myself, right, for whatever that has to come tomorrow. What will come tomorrow? Well, nobody knows, unfortunately, right? So I think that is one of the few things. I mean, those are one of few things that we can kind of um, look at when it comes to preparing ourselves and managing our stress, right? There is a question on, is there major impact of COVID on our lungs in long term? Yes, there is a possibility. Of course, we know that COVID affects our respiratory system, and it has shown people who would have a long-term issues with the lung health of the lungs, right? So it is a possibility. So if you have recovered from COVID and if you still have any respiratory symptoms, most of the time it is important for people to follow chest physiotherapy and chest rehabilitation post recovery, because a lot of people do have lung related lingering symptoms, be it say a cough or chest pains or muscle weakness in the chest region. So it's important that you do talk to a physiotherapist, you do talk to your physician, and then follow follow the instructions that they are giving you or the advice that they are giving you to hopefully have a better outcome. So that's important, right? Why people become aggressive or hyper during treatment of COVID? I'm unsure of where this question is coming from, but let me tell you what I know about people who are admitted in hospital, right? When people with severe infection, and that could be anything, it's not just pertaining to COVID, but people who are having severe infections or serious diseases and who are admitted in, say, ICUs, a lot of them not may have a tendency to suffer from what we call as ICU psychosis, right? That they undergo periods, or this is short-term periods where they feel excessively, they might be hallucinating, they might be having delusions, and it does happen. And usually there are certain medications which can be given. In the COVID scenario, it's a little difficult because certain medicines, these medicines also sometimes have side effects, and which cannot be given where people are already having a lung ailment. But yes, that is something that is quite common. And because there are so many people who are unwell with COVID, this could be a possibility. And I'm really sorry that that's happening. But I hope that the doctors would help you in this. All right. Good. There's a few more questions. Please highlight on depression signs and effect of overloading and continuous screening. Well, depression is quite common, right? We don't talk about it as much. There's statistics which says that everyone goes through some amount of depressive symptoms sometime through their lives. Okay, it might not amount to a disorder, but everybody experiences it, and it's normal to experience that, by the way. But when it comes to disorder, it is seen that, say, about 1 in 6 to 7 people do have some mild to moderate or severe depression at least one time in their life. So it's a very common thing to happen. Depression is very, very common, okay? And it's important that we just, we accept it, that this is something which is normal and it can happen to anyone. And it is not something that has been brought on by somebody. A lot of times people feel that, there was a reason why somebody, something that I did and hence depression happened to me. It's not like that. People feel depression can happen. It's a, there's a biological component to it. There's a social component to it. There's a physiological component to it as well. But what are the symptoms and signs, right? So usually people would feel sad, depressed, or low for more than 2 weeks on a run, and they will have a sense of disinterest in doing any pleasurable activities. Things which made me feel happy are not making me happy anymore. That kind of a symptom that people would have. But apart from that, there could be, a sense of gray or bleak future. There could be sense of hopelessness or helplessness, sense of guilt. There could be suicidal thoughts or suicidal ideations or suicidal acts as well. There could be change in their behavior in terms of their sleep pattern or eating pattern, or they could be excessively, they could be very, their volition may change in terms of they could be excessively hyper, or they would not be doing anything at all, or very, very withdrawn. So there could be many symptoms of depression. Now, depression, usually the most common thing that we can do is do a basic self-screening of depression, which is called as the PHQ-9 screening questionnaire, which you could do it for yourself. But if you're feeling that you are low or sad or depressed, it's a good idea for you to reach out to a professional, a psychotherapist, who would be able to help you in assessing what you're going through, and then helping you with what could be the strategies that you need to go ahead. Now, this could mean therapy, or it could also mean consulting a psychiatrist who could give you some medication to help you tide through the situation, right? So it is important for us to not brush it under the carpet, but take it as something that can happen as common as having fever, right? I think it's important to normalize mental health issues so that we are more open to seeking help, okay? There's a question called right time for vaccination after getting cured from COVID. Well, from the date of recovery, you need to wait for at least 12 weeks before you can take your vaccine. Hope that answers your question. After COVID recovery, how to remove tiredness and weakness in our body. Well, first of all, I'm so happy that you've recovered and you're healthy. So that's great. Feeling weak and tired is quite common in the post-COVID recovery phase. Ensure that you look into your diet, ensure that if there are any deficiencies, say vitamin D deficiency or any kind of deficiency, say iron or any other vitamins, ensure that your deficiencies are corrected well. Talk to your physician so that they can help you with that. Ensure you're looking at your diet well, and get into a mode of, exercising very slow and very steady in terms of just stretching and doing deep breathing exercises to begin with. It is common to feel tired and weak for 4 to 8 weeks post recovery as well. So take it slow, okay? Take it slow, but over a period of time you will feel better. Just ensure that you are getting into a phase of healthy living. Follow all the tenets of healthy living and be in constant touch with your physician. Ensure that you have, if you have been somebody who has taken a lot of medication, ensure that you are following up with your doctor. They may want to get your sugars checked, blood pressures checked, or may get even other tests done. Ensure that it is all looked at, right? Say, for example, liver function test. So ensure that they are all done under the guidance of your physician, so that if there is any other issue, they might be able to help you for the same by giving you the right medication. All right. So there's a question. There's a lot of ambiguity and theories related to vaccine. What is the significance of vaccines and the choices? Well, now that we'll have a lot of vaccine choices, I think that is left to everybody. But all the vaccines that we are having currently have been found to be efficacious, and it does help in building some amount of immunity. Understand that vaccine doesn't mean that you cannot get the illness, right? The risk of illness is always going to be there. What vaccine has shown to do over a period of time is that it has shown that it reduces the severity of illness. Vaccinations reduce definitely the death rates or mortality. Vaccination thereby reduces the burden on the healthcare system and helps in breaking the chain of transmission. So that is where vaccinations help, right? So over a period of time, we will have lesser number of people falling sick as more and more people are getting vaccinated. But understand that vaccination by itself is not a reason for us to go away from preventive measures. They're always there to be followed. All right. Um, Great. So I'm just looking through our questions. Is there something that I have not answered? Um, all right. There's another question which is here. How to get over guilt factor? See, I think I'm so sorry that you're feeling that way, right? That now guilt, usually I have seen that people feel a lot of guilty. Guilt can be because I'm not able to take care of people I love, or that I have been a source of infection for people I love, or that I'm not able to, care for, say, ailing elders or family members who are away from me and in a distant location. So those are the reasons many times I have seen that people have feel guilty. I think it's important for us to again go back to our basics and see, what have I done to be prepared about it? What have I done to be there? Even if it means to be there virtually. A lot of times, just being available virtually is also the best thing that you can do, and that is something that is an over a period of time will help you in reducing your the guilt that you're going through. Ask yourself that, is there anything else that you could have done in the current situation? Maybe not. What you're doing is great, and tell yourself that every day. It is a difficult place. If you're finding it very difficult to kind of cope with such a feeling, it's a good idea for you to talk to a counselor or a psychotherapist who would be there with you and help you, listen to you, and hopefully find strategies together with you to get over this feeling. All right. So great. I mean, I think there are no more questions. So thank you here. Thank you for listening. Thank you for being available for yourself, and making mental health as normal as anything else. It's important that in this pandemic phase, we are available for people who matter the most for us, and we at the same time we ensure that we take care of ourselves first before we take care of everyone around us, right? So take care of yourself, stay safe, stay healthy, get yourself vaccinated, and let's catch up again in the next webinar. Thank you.
Download the MediBuddy app now. Subscribe to our YouTube channel for more updates.